Hello, my name is Arlene Makoko and I'm a reporter and here host, and I've got some really great guests I want you to meet. To my left is Dr. Sarosh Roshan. She is the founding president of the International Health Awareness Network, or IHAN, and next to her is Professor Gabrielle Casper. She is from the University of Notre Dame in Australia, and she has a special interest in violence against women. And to my right, I'm joined by Jordan Williams. She's the youth representative for IHAN. So she's going to talk a little bit about what she does, and she's at the UN, so she's based at the UN. First, I'd like to start with Dr. Roshan, who is the founding president, and find out a little bit about why she felt the need to develop this organization. Dr. Sarosh.
Thank you, Eileen. I was representative of Medical Women International to the United Nations since 1975. And I was asked to go to Nairobi, Kenya for end of the decade conference for women in 1985. This conference was attended by 12,000 women from all over the world. I was a junior gynecologist with the delegation. At the opening night, somebody on the podium got sick, and they announced, is there a doctor in the house? So I attended to the patient, and immediately I became a well-known doctor in the conference. The following day, when the American delegation were invited to go to a village, they invited me to go with them. I must tell you, in our delegation, very well-known politicians and activists and important people, such as late Bella Abzug, such as Betty Friedan and Maureen Reagan, and many others. But I accompanied them. After the event at the village, the head of the village, a Kenyan lady, came to me and asked me, why don't you help us? I said, why me? All these very important people. And she said, you have compassion for us, and you have access to these people, so you will become our ambassador. This was my calling.
Wow.
So I discussed this with my roommate, Sybil Shainwald, who is the founder of National Women Organization, and she said, if you want to help them, I will help you. So that's how IHAN got started.
That's wonderful.
During the last 30 years, we have done many health projects, educational projects to many African countries in particular. We did 10 years literacy program in South Africa. We've been to Sudan for genital mutilation, to Somaliland for healthcare. And we have collaborated with other non-governmental organizations. We have united with my colleague, Professor Gabrielle Casper, and every year we have two major activities. One is with the Commission on the Status of Women, and in the fall we do an important program for something that I think urgently is needed. So this year we are doing a program on the impact of violence on health and education at Fordham University Law School, and I have invited my colleague and my friend, Professor Casper, to join us for this upcoming program.
Well, I'm glad that you brought her up, because this is something that continues to capture headlines and to draw the public into this important dialogue about women, about violence against women, healthcare. So if you could, Dr. Casper, talk to us about some of the updated numbers and statistics when it comes to women and violence against women.
So I'm a gynecologist in Sydney, and in my own practice in a very affluent area, I couldn't believe how many of my patients disclosed to me that they had had rape or incest in the past. And it made me aware that something of a large magnitude was occurring. It was only when I took a particular interest in the area I realised how bad it was. And violence against women is a pervasive human rights violation of pandemic proportions. In the USA, 1/3 of women who are murdered by their intimate partners. It's a horrific number. Women aged between 15 and 44 in both Australia and America are more at risk of domestic violence than they are of medical issues involving cancer, motor car accident, malaria, and war. They're horrible figures as well. And in Australia, in fact, partner violence causes more morbidity in women of reproductive age than smoking tobacco, than high blood pressure, or than increased body weight. And yet all we hear about is lose weight, don't smoke. And look at it, violence causes more morbidity in women. And then the long-term effects of violence, rape, incest, it's not just the obstetrics and gynecology issues. These women are likely to present with far more migraines. They're going to present with bowel issues, with irritable bowel, with post-stress trauma. They're going to keep being an enormous burden on our medical practices and the costs of our countries. It's a large financial burden. So we've got large issues within our country, but then we've got this extra thing in other countries in particular, where culture also is a horrific violation on women. Female fetuses are often terminated. Young girls have to go through female genital mutilation. They're often not taken to school. They're not educated. They're sold off as young brides. If they deliver their babies too early, they're likely to have fistulas. They may well have violence from their partners, and in many countries, when they become widows, they are tortured. So the whole of their life cycle rotates around various types of violence. And again, you'll think, that's in other countries. But in fact, people have migrated to developing countries, from developing countries to developed countries, and have brought these cultural practices here to Australia and to America. So things like dowry murders because a woman wants to pull out. She doesn't want to be a child bride. These dowry murders, they're occurring in America and Australia. Trafficking of women is an enormous issue. It's been going on for at least a century. These women have no rights. They are here on our shores. Also, war. It is cheaper to rape a woman than to waste a bullet on them. So often in areas of war, women are raped, they are sexually abused. There's now a trend of doing female genital mutilation on young babies and young women. They have forced pregnancy, forced sterilisation, forced termination of their babies. These things that are done to women during war are absolutely horrific. And then let's look at it from the flip side. What about our military? Our military go into these areas as peacekeepers. They want to help out. They dig the bullets out of the men. They stop the bleeding. But when a woman says, I was raped and then I was gang raped, most of our military are not trained in this area. What can they do except sorry and move on? This also isn't good enough. We need our military to know how to deal with these issues. So we really need to start training doctors, nurses, armed forces in how to deal with women who have had violent situations, and in particular, sexual violence. This needs to start in our medical schools, our specialty training, and throughout the whole of our community. I guess the question is what's happening in the future? And my medical students receive lectures on violence. They receive training on how to deal with women in acute rape and the long-term situation, and also in dealing with women with the long-term issues of incest. From the future's point of view, I don't know that these programs are doing much. Telling people to pin a little white badge on and saying it's White Ribbon Day and saying don't violate women, repeating this message, I don't think it's going to change anything. Men know that they shouldn't violate women, and yet it still occurs. Just telling people to repeat the slogan, it's not going to change anything. I'm hoping that our solution is going to rely in technology and the media. We need the technology to capture the events and the media to publicise it. And I think once the world sees what is happening, that's when we're going to get a cultural change. However, I've got to admit, everything I'm seeing and talking about is through the eyes of an older woman doctor. And perhaps what we really need is other people from other areas to bring through their thoughts. And I'm hoping with youngsters like Jordan, who's a young lawyer, she's going to come across with far more modern ideas about solutions. We're all very aware about the issue. I am concerned about the solutions.
And I'm so glad that you mentioned that. Jordan is right here joining us and is going to talk about what can be done when it comes to violence against women. You're the youth representative. You bring with you technology and so much. Talk about this issue and first how it affects young people and what's being done to help to solve these problems.
So according to the UNFPA, youth are about 26% of the world population, depending on what you look at, 40% under age 24, and then the 26 under age 15. And so we can see the impact of violence on youth and lots of current events. So when we talk about violence with armed conflict, it could be a state-sponsored event, like what we're seeing going on in Yemen right now. It could be religiously or ethnically charged violence, like we're seeing going on in Myanmar. It could be things like community violence or homicide rates that rival those of active war zones, like we're seeing in Honduras and other areas of the Northern Triangle, and as we're seeing playing out in the media right now. Also, we would want to bring in things like sexual and gender-based violence, as well as sexual harassment, which is a large impact on women here in the U.S. and in other other developing nations. And it's something that we're seeing being uncovered more and more and more with the birth of the Me Too movement and other things through social media, through technology, and just kind of making it aware and giving a platform for women to A, say, this has happened to me without any sort of shame or stigma, and then B, to demand some sort of justice or restitution for what's gone on.
Okay, and I'm so glad you brought up the Me Too movement. Tell me how that has helped to shape your message and empower you to do take on some issues that are pretty strong and very disturbing in many ways.
So with Me Too and with a lot of other movements, I think a lot of it is around awareness wearing and information sharing. So getting out what's going on, how it's going on, and looking at strategies and solutions.
Okay, strategies and solutions. That sounds great.
Yes.
When you talk about strategies and solutions, what are you talking about? This is, we have, the populations are so big both here in this country and internationally. How can we impact this thing on a broad global scale?
So at the global level, we have a lot of different resolutions, things in UN human rights law that's been around since the 40s. Those guarantee access to basic rights, so things like healthcare, so that you're healthy enough to look after your family, to go to school, to study, a right to education for all ages, things that let women set themselves up to be independent, self-sufficient, and to really dream about and cause the change they want to see. The back end to that, of course, is mentorship and guidance throughout the process. But unfortunately, a lot of times change is greatest at the local and community-based level. That's where the change takes place. That's where the engagement needs to take place. So one example of that here in New York will be our conference on Saturday, partnering with Fordham University. So we'll be bringing together people from the UN community, but also doctors from Australia, locally, to talk about the issues, talk about how it's being addressed in different situations. Another big issue that can always, I guess, a strategy that can always be applied is to engage with local leaders. So community, religious, cultural leaders, when we talk about harmful traditional practices like child early and forced marriage, female genital mutilation. Also engaging with pop culture icons who are the maybe a generation and a half above that are kind of setting the standard and the model for what kids are growing up seeing, who are saying it's okay to discuss women in this way in music and media and literature, and kind of giving the guidelines and the rules for what our cultures become as we develop.
Interesting, really interesting. So right now I'd like to open it up a little bit to the three of you experts in this area, and I'll start with Dr. Sarosh. You founded this organization to really at a critical time help women in Kenya. Since then, have you seen any changes in terms of how women are being treated in societies? Is there more of an urgency today, or is it the same as when you founded IHAN?
Well, I'm happy to say that we have made progress. We still have a long way to go. But for example, genital mutilation is one of the areas that I was personally very active about since late 70s or early 80s. I was invited to go to WHO about the meeting about genital mutilation, and this meeting was for the policymakers, for ministers and powerful people. And when I started to speak about the medical hazards of genital mutilation, a minister from one of the African countries asked me that, "You did not have this done on you. How do you know?" And imagine, I was very young, very timid, very shy, but I took a deep breath and I said, "Your Excellencies, I did not have open heart surgery. I did not have my stomach removed. I did not have many other diseases, but I studied 20 years and I have been treating patients, so I know. I have delivered women who have had genital mutilation." And the audience received my comments very well. Some
Really wonderful.
15 years later, I was invited to Sudan to celebrate the banning of genital mutilation in Sudan and many other countries. And I was invited to a wedding that a bridegroom had a plaque saying, "I am proud that my bride did not have genital mutilation." So in my lifetime, I have seen the problem, although it still is happening, but at least legally is banned in many countries. Also, I was very much involved with the anti-smoking activities. When I was elected to be General Well-being Secretary, for my plan of action, on the top I said, smoking is hazardous, especially for women, and my colleagues got angry about my comment, and honestly they booed me, that who are you to tell us to smoke or not to smoke? 20 years later, I was in WHO with our secretary from Norway. You remember, medical doctor, pediatrician, when WHO had the resolution banning smoking. So 2 examples that I have seen progress in my life.
Mm-hmm.
Now we have to work on issue of eliminating all forms of violence against women. This has been a persistent problem for so long. United with the young and old and people from all walks of life, we will bring about the change. This Saturday, we have a conference. Amongst our speakers is the councilwoman of District 6. She's going to talk about the policies and training the police. We have faculty of Fordham University that they're going to talk about how they have created centers and hotline and how they're teaching the young students to deal with it.
Yes.
We have ambassador of Tanzania who's going to talk about violence prevention in Tanzania. So we have high expectation that this conference and the recommendation of this conference, which we're going to publish it, and we're going to take it to schools, to churches, to learning institutions, and we are going to have the media. You're helping us to raise awareness as fast as possible. And united, and once for all put an end to all kind of violence.
That's really amazing work that your organization has done in countries that are very conservative and very much into their cultural traditions. So that's pretty amazing. And now I want to go to Professor Casper. The Me Too movement is something that has been really prevalent in this country. Tell me, how is Australia taking this? Is this something that is global? Talk about that.
Yes, look, it is absolutely definitely global. And it covers a variety of things. It starts off with the way a man treats a woman at work. But in fact, really, it's not just about a power play of work. It's about the power of a man over a woman, whether it be at work, outside work, in the home, in any environment at all. So we haven't just left it as in the workplace. We're spreading it further apart. And I think that the outcomes are going to be twofold. And one is schools, universities, all training areas are going to try to train women in this area, in knowing this type of behaviour, women and men, that it's not acceptable. The next thing is NGOs led the way. They gave money and supplies to different areas. They're now linking that with anti-violence campaigns. A lot of federal governments are donating money to developing countries, but they're linking that with anti-violence campaigns. And I think they're also aware that there is no way known it is ever going to be successful unless you include men. So as well as the Me Too movement, Australia is very, very involved in a program called Champions of Change. And in this area, we are actually rewarding men for encouraging other men to decrease violence in their home life and in their work and professional areas. And I think it is only with men wanting the change that we're going to be successful.
Great, thank you. Thank you for that. And we look forward to hearing more about all of this on October 27th. And we're going to go to Jordan really quickly. And just you're a student. You are a student a graduate student at Columbia, and you're sort of specializing in mental health, global health.
Yeah, neuropsychology, global mental health.
Really great, really great. Yeah, go
So on the policy end, two initiatives that IHAN engages with are CSW, which is Commission on the Status of Women in March, which focuses always on women's rights issues, and violence is a big part of that, as well as the Global Compacts on migration and refugees. And so looking at that policy process, we've been able to talk to women on the ground, different grassroots organizations, but also to collaborate with different NGOs around the world and really get their feedback and their input, and most importantly, I think, best practices. So
let me ask you this, tech, how does that relate to
a big part of it?
Yeah,
so sometimes with I'll give international NGO conferences on this example, we'll do basically a Skype call, and we're able to talk with women around the world and ask what they're doing on the ground, what has been successful in talking to this community chief about changing female genital mutilation, what has been successful about changing the way that sports teams are, set up, and the way that they compete in the U.S. at a high school in the rural South, and really take those best practices and then take it up to the international level to governments and saying it's not that hard to affect change. As long as we have the political will, I think there's always women on the ground that are willing to do the work. And so we just have to know what works best. I think women in particular are great at collaboration, at brainstorming, working together. And I think through IHAN, through our work at the United Nations, we've been really successful in impacting change.
That is really, really wonderful to hear what is happening on so many different levels. We're going to look forward to hearing more about everything. I'm joined with these amazing guests talking about women, global women, and tell me a little bit more about how long is the conference now? It's one day. Yeah, talk about.
Yep. So it's a half-day conference from 9 to about 1:30. And so the first bit of the conference, we'll talk about the cycle of violence, so why violence tends to reoccur, go through generations, and then we'll look down through the lifespan, how it impacts, and pregnancy and perinatal period, early childhood, childhood development on through senior age. Then we'll talk about some of the policy and advocacy initiatives. So we'll have the ambassadors from Tanzania and our local councilwoman. And then we'll start looking at the strategies and solutions. Okay. So we have some younger representatives, some doctors, we'll have people in the media talking about what they're doing to affect change. We'll have some student contest awards, so people in the New York City community, younger perspectives, and then we'll close out with kind of a brainstorming session.
So this is something that all women can come, it's open? Yes.
Yes, would you share the co-sponsors?
Yes. So it's being co-sponsored by Fordham University, the Graduate School of Social Service,
yes,
as well as the Global Movement for the Culture of Peace, which is very active at the UN with us, the United Nations Working Group on Girls, and I believe there's one more.
And as you think of the next one, you definitely represent the demographic that is really kind of watching this or experiencing this firsthand, the Me Too movement, that kind of thing. Just talk about your personal perspective on what you see happening and maybe among your classmates. What is happening? Do you feel like women are being more empowered to come forward? Just talk about that.
So I'm a Texas girl, born and raised in the South for the most part. And so I've had a lot of interaction at the border, seeing how things are carried out on a political level, and also in the, provision of services level. So seeing how women don't feel comfortable asking for legal aid, for medical aid, and sometimes just not knowing what rights they have under international law, under domestic laws as well, or crossing borders, because my focus is in migration. I do think within recent years, it's become more so okay to say that you need help and to admit that things have happened to you. But I think, unfortunately, we still don't have the space that we need to enforce change and to affect change. I think at the UN there's a lot of space for youth, but many times I'm still one of the youngest people in the room, one of the only young ladies in the room, which is great, but there should be so many more of us. I think, as I mentioned, youth are almost 40% of the global population, the fastest growing population. When we think about migration and displacement, their under 18 is at least 52, and that's a conservative estimate. So I think a lot of it needs to be asking younger people what they want and how they want to see change affected, because culture moves generation to generation. It's always growing and developing. So yes, we inherit some from our parents, but it's incumbent upon us to dream about the future and to make sure that we sculpt the future the way that we need it.
The way that we need it. And so we're seeing that it really has so many different areas when it comes to empowerment of women, of children. You're talking about migration, and this is a new area also. So many things to work with. Are you hopeful that this whole idea of separation at the border and all the things that are happening, are you hopeful that there'll be a good resolution and a way to really handle populations in a way that honors some of the missions that you have with IHAN?
Well, I'm an optimistic person,
Okay.
and I have faith in the young people. So the younger generation are going to find solutions. Our job is to support them and do the best we can and share our experiences. I would like to thank our panelists, and
Yes.
most importantly, I would like to thank BRONXNET, the executive director, Mr. Michael Navi,
Okay.
who has been supportive of my work for so many years. I sincerely appreciate that. Thank you.